2024 early look at potential Social Security cost of living increases and Medicare costs. Hi, I'm Chris Bryan, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. If today is your birthday, then happy birthday to you. John Glenn said, "Few women admit their age and few men act theirs." So before we get into this early look of 2024 Social Security cost of living adjustments and Medicare costs, I want to make a very important disclaimer. None of this information is to be construed as specific plan information. This is public information and readily available on the internet. Anything can change between now and October 1st or the end of the year. So I'm getting the first part of this information. This comes from the Medicare Trustees Report, which you see the link on there. I will try to put a link in the description as well if you want to access it. So let's start with Part A, hospital, and how that is changing for next year. So the deductible, that's what you have to pay for day 1 through 60 of coverage, is going from $1,600 to $1,652. Your copayment from day 61 to day 90 is going from $400 a day to $413. And then your copayment from day 91 to 150, those are your lifetime reserve days. You get 60 of them. Once you've used them up, they're gone. That is going from $800 to $826. Then we have Part B, that's your medical. That's when you go to the doctor, the specialist, you get lab work, outpatient surgery, radiation, chemotherapy, things like that. So your standard premium, they estimate, will be going from $164.90 to $174.80 or possibly $179.80. Now, if you have a what's called IRMA, income related monthly adjustment amount, if your income is over the threshold, then you will be paying higher for that. Your Part B deductible will be going from $226 to $240. Increases, once again, are blamed on an Alzheimer's drug, this time Leqembi. Then we have Part D drug coverage. So Part D is broken down into 4 stages. There's a deductible, initial coverage limit, coverage gap, also known as the donut hole, and the catastrophic coverage. So your base premium is going from $32.74 to $34.70. Now, don't even really consider that. The base premium is really designed just as a number to calculate the late enrollment penalty. We will get into some other estimates on premiums later. So your deductible, if you end up having one, is going from $505 to $545. The initial coverage limit is going from $4,660 up to $5,030. And that means your coverage gap will now start at $5,030 and it will go up to $8,000. You will still be responsible for 25% of the cost. But in 2025, there is no donut hole coverage gap that will be in Part D after 2025 or starting in 2025. Catastrophic coverage will then go from $7,400 to $8,000. So there will be no 5% coinsurance now in the catastrophic coverage stage. Let's take a look at what the Medicare Trustee Report says about this. The standard Part D benefit design for beneficiaries not eligible for cost sharing and or premium subsidies is restructured as follows. In 2024 and later, the 5% cost sharing currently required from the beneficiary during the catastrophic phase, that is after the beneficiary reaches the out-of-pocket threshold, is eliminated, thereby capping previously unlimited out-of-pocket costs for the beneficiary at the out-of-pocket threshold level. The allowed costs in the catastrophic coverage phase will be borne by the drug plan and by Medicare at 20% and 80% respectively in 2024, as opposed to the current catastrophic cost distribution of 5% from the beneficiary, 15% from the drug plan, and 80% from Medicare. So no 5% coinsurance during the catastrophic phase, which will also lead to less costs, especially on expensive medications. Take a look at this from the Kaiser Family Foundation. What they've done is they've taken a look at 5 of some of the most expensive medications that are out there, and you will see that they range in anywhere in beneficiary costs from $11,400 up to $14,900 in 2023. But in 2024, they all dropped down to $3,300. So that is good news for people that are on some very high cost medications. So there's no 5% coinsurance anymore in the catastrophic stage. There is lower prices, therefore, for the expensive medications. So because of this, health plans will now be picking up that additional 5%. The question is, will this lead to increased premiums copays, and deductibles. Well, you would think so. When the insurance company has to pay more, that means that the premium's going to go up and you're going to have to pay more. But enter the Inflation Reduction Act of 2022. Let's take a look at that because it's important. First, the Inflation Reduction Act of 2022 will lower the average total Part D premiums in 2024. Quote, the projected average total Part D beneficiary premium is projected to decrease by 1.8% in 2024 from $56.49 in 2023 to $55.50 in 2024. The average total Part D premium is the sum of the average basic premium and the average supplemental premium for plans with enhanced coverage and is most accurate current projection of what people will pay in 2024 for Part D premiums. 2, it will lower the average supplemental Part D premiums in 2024. Medicare has a lot of average premiums for Part D, different ones. Quote, many Part D plans provide a richer benefit than the basic Part D benefit. For instance, through lower cost sharing than required under the basic benefit coverage for certain non-Part D drugs, etc. Such plans are called enhanced alternative plans. The supplemental coverage provided by an enhanced alternative plan is paid for with an additional monthly supplemental premium. Roughly 75% of beneficiaries are enrolled in enhanced plans in 2023, end quote. It goes on to say the program-wide average supplemental Part D premium is projected to decrease from $24.40 in 2023 to $21. So that's very good news. Number 3, LIS, low income support or subsidy, and extra help is expanding from 135% to 150%. This is probably going to affect some people. So it says, quote, the low income support or the extra help program will expand so that beneficiaries who earn between 135% and 150% of the federal poverty level and meet statutory resource limit requirements will receive the full LIS that prior to 2024 were available only to beneficiaries earning less than 135% of the federal poverty level. These subsidies provide for zero premiums and low-cost fixed co-payments for covered prescription drugs. So, because of the changes to Part D coverage for 2024 and 2025 that are coming due to the Inflation Reduction Act of 2022, it seems reasonable that there could be significant differences in your Part D coverage for 2024, especially if you take brand name medications. It would be prudent to check your coverage for 2024 during the annual election period from October 15th to December 7th to make sure you will have acceptable drug coverage and costs. And I can't tell you how many people just roll over from year to year and don't check their medication coverage, and all of a sudden January rolls around and their premium went up, deductible went up, their co-payments went up, a drug wasn't covered, whatever it may be. It is always wise to check your prescription coverage during the annual election period. That's why they have it for you. All right, let's take a look at Social Security cost of living adjustments for 2024. This information is coming from a variety of sources, most notably the Senior League. So this year, we saw an increase of 8.7% for 2023. That was because of the high inflation that we have had the past couple of years. Next year, 2024 is estimated to be a 3.1% increase. Meanwhile, through June, inflation is averaging 4.89%. Social Security benefits have lost 36% of their purchase power since 2000, and that is from Senior League as well. So what does this mean to you, and what is the takeaway from all of this? Do you have either a standalone Part D prescription drug plan or Medicare Advantage plan with Part D coverage? Are you taking any brand name or specialty medications? If yes to both of those, then give serious consideration to making sure you will have acceptable drug coverage and costs for 2024. You can do that by either using the Medicare prescription calculator at medicare.gov, or you can reach out to me if you live in one of the states that I am licensed in during the annual election period from October 15th to December 7th to see if I can help. If I can, I will, and if I can't, I will certainly let you know. Either way, you will need the exact name of your medication, the exact dosage, the milligrams, the milliliters, etc., and the quantity per day or per month. So that is a very early look at the 2024 Social Security cost of living adjustments and Medicare cost adjustments as well. I hope you have found that helpful. I would stay tuned for in October for more enhancements on this and clarifications on this as well. If you have questions, if you need help, and you are from one of the states that I'm licensed in, please reach out to me. You can go to my website with lots of information. There's a couple contact pages on there where you can connect with me with as well. States that I'm currently licensed in: Virginia, North Carolina, South Carolina, Florida, Tennessee, and Texas, with more states coming soon. You can go to my website for an up-to-date list or check the About section of my YouTube channel page. Do you live near the Charlottesville, Virginia area within about an hour or so? If you do and you would like to meet in person, then by all means reach out to me and we can schedule time to meet at a safe and convenient location. I want to remind you to like, subscribe, and share this video. And if you don't mind, in the comment section below, please let me know what state that you're watching from, or put a question in there and I will try to answer it for you. That's it for today. I'm Chris Prang, the Medicare analyst. Make it a great day.